Hello, everybody. My name is Dr. Danny Sherwinter. I'm the Chief of Surgery at the Mount Sinai Brooklyn Division. So bariatric surgery is the medical term that doctors use. It's another name for weight loss surgery. And it's the name given to a number of surgical procedures that we do, that we offer, that what we call it alters the digestive anatomy, which means that we operate on the stomach and the intestines in order to change the way that the food gets processed once you eat it. And it's designed to help people that are struggling with their weight to lose a significant amount of weight and therefore have a significant impact on their quality of life and their other medical problems that they may have that may be due to their weight. Bariatric surgery obviously is not perfect for everybody, and there are obviously where the key is to that we're not out there saying surgery should be for everybody and everyone should have surgery. That's not what this is at all. But what the important point is that patients should have exhausted all other options before they try surgery. So obviously, any surgical procedure, no matter what it is, has some risk involved, whether it's the risk from the surgery itself, risk from anesthesia. There's always some risk involved. Now, all of the operations that we do for weight loss are extremely, extremely safe, but there's always some risk involved. So what I always tell patients is that they need to convince themselves, not to convince me, but to convince themselves that they've really exhausted all of the other options for weight loss, whether that means the going on diets, whether that means exercise, whether that means working with their doctor or nutritionist to try to lose weight on their own. They really have to feel like, listen, this is my last resort. Because ultimately, if a person is able to lose weight on their own with diet and exercise, more power to them. And that's wonderful. And that's definitely safer than surgery. But, once they've exhausted all of those options and they really feel at their wits' end with their weight, surgery can definitely be an option for people and a very safe option, an excellent option. And that's really the key is that when people come to me, most of those people, all of those people have tried some other form of weight loss. And we hear the usual kind of story, and everyone's experienced this, where they come in where they say, I went on a diet, I lost 20 pounds on the diet, which is great. But then they gain 30 back. So it's that yo-yoing up and down and up and down. And at some point, people say, listen, I think I've really tried it all. I've done every diet that I can. I've worked with my medical doctor trying to get my weight off, and nothing is really stuck. And ultimately, when we talk about weight loss, the kind of weight loss that we need to improve our medical health, we're not talking about losing 10 pounds or 15 pounds or 20 pounds and then gaining 30 back, or losing 50 and gaining 80 back. That yo-yoing in some way is worse for patients. And what we really need is losing the weight and keeping it off. And for that, there's no question that the surgical options, bariatric surgery, is really best for that. So is bariatric surgery right for you? Well, again, I really feel that this is something that you have to have a really honest conversation with yourself and say, listen, have I really tried everything else, failed every other option? If I have, surgery may be right for me. And of course, speak to your doctor about it. Speak to your medical doctor about it. The best patients for us are the patients that have really worked hard, been there with their medical doctor, and their medical doctor at some point says to them, listen, I've been managing your diabetes. I've been managing your high blood pressure. I've been hearing you complain about it. Well, your joints are hurting you. And, I think it's time. It's time to consider a surgical procedure to try to get your weight down. It's time to consider bariatric surgery. And then those patients come to us. So with their medical doctor's advice and opinion supporting their decision, they come to us for a discussion about whether surgery is right for them, what surgery is right for them, etc. Right. So a term that you're going to hear very, very often, and a very, very important number, is to calculate what's called the BMI. And BMI stands for body mass index. It's a very important number. And whenever you're going to talk to a medical professional, a bariatric surgeon, whenever you're going to look online and you're going to talk about, read about what people say about weight loss surgery, et cetera. And of course, when you're going to be talking to your insurance company about potentially covering this operation, the number that's going to keep coming up is BMI, body mass index. So it's a really important number to calculate. And the concept is that weight loss surgery is really designed for people who are overweight, but quite overweight. And the numbers that we usually give people is that when someone's BMI, body mass index, is over 35 and they have other medical problems like high blood pressure, diabetes, those are the patients that should start considering weight loss surgery, or if your BMI is greater than 40. Now, again, body mass index, how do I calculate that? The best way is to go online. There are a million calculators out there. In fact, if you just take your iPhone and say, hey, Siri, what is my BMI? My height is this amount. My weight is this amount. It will tell you what your BMI is. And again, if someone's BMI is over 35 with medical problems or over 40 and otherwise healthy, those are patients that could qualify for weight loss surgery. Now, just to give you an example, someone who's, let's say, 5'4", which would be kind of a pretty average height for a woman, and let's say over 200 pounds, their BMI would be over 35. So the typical story is a woman comes in, she's 5'4", her weight is around 200 pounds, and let's say she has sleep apnea, or well, let's say, she's coming up on diabetes, on high blood pressure. That's someone that should really be considered for weight loss surgery, and someone that the insurance companies would be covering if they decided that surgery is for them. Right. So as I said, the best way to calculate it is go online. Again, just saying, "Hey Siri, what is my BMI?" and you'll put in your height and weight, and it will give you the number. So very, very easy to come up with that number. And again, the key numbers are a BMI of over 40 and you're otherwise healthy, or over 35 and you have other medical problems like high blood pressure, diabetes, sleep apnea, those types of weight connected type of medical comorbidities, medical problems. The reason is because if you look at someone's weight alone, it really doesn't tell you whether they're overweight or not. The best example is if someone weighs 250 pounds, right? Are they overweight? And the answer to that is, well, it depends. If they're 6'5" and they're 250 pounds, that might not be very overweight, versus if they're 4'5", they're very overweight. So what we really want to do is get a single number that really tells you if they're overweight for their body size, basically. So it's a number that you put in your height, you put in your weight, and it does a calculation of comparing those two things, and it pops out a single number, an index number, and it's able to give you with that number whether you're overweight, and again, it goes in normal weight, overweight, then it becomes obese, morbidly obese, and it will tell you instantly where you fall within those parameters. And again, very easy to do online, multiple calculators for that. So I really recommend the first thing that patients should do when they're considering weight loss surgery is calculate their BMI and see where they stand. Again, like I mentioned before, it depends really on your insurance whether you need an actual referral. But in general, not really. Patients can definitely decide on their own that they want to come in and talk to us about weight loss surgery. But again, I strongly encourage people who are considering it on their own, I strongly encourage them to discuss it with their medical doctor and get the opinion of their medical doctor. And they'll often be surprised that their medical doctor will be very supportive of them having weight loss surgery. I think that some medical doctors particularly are, they're scared to even mention it. They don't want to start talking about surgeries for their patients, or they don't want to really point out that their patients weight is a major impacting factor on their health. Medical doctors, they sometimes feel embarrassed about bringing it up. And I know you're thinking that, medical doctors, how could they be possibly embarrassed to discuss these types of things? But studies have shown that they actually are. And, if the patient themselves brings it up, you're always your own best advocate, right? So if you bring it up on your own and you say to your medical doctor that's been caring for you for many years, you say to him, I know you're about to add another blood pressure medicine on for me. I was thinking and reading about online about weight loss surgery. What do you think? And you'd be surprised that they may actually very much jump at that and help you find a practitioner that performs the weight loss surgery, the bariatric surgery, and help you with the paperwork that's going to be needed to get the insurance approval for it. So, bringing your medical doctor in on the discussion early on, telling them where you stand, all of that is very, very important. And that's where the referrals kind of come in. So again, some insurance companies, of course, do require referrals for specialists, but even the ones that don't, I would strongly recommend getting your medical doctor's input on that decision. So there definitely are. So, this is something that's been conversation and a controversy that's been going on in the field, and even in the lay press for many many years. And yes, there are a number of bariatric surgery options available for patients, and a big part of the conversation that we have with patients when they come to the office are the different options available from a surgical standpoint, what we offer, what we can do, and what is the best choice for them. So absolutely, yes, there are a number of different bariatric surgeries, and they can be very confusing to people. They start reading about it, and there are confusing names, and some of them are called a number of things even, and it can be very confusing. So let's talk about the basics. First of all, the most basic point is any one of these operations, no matter what they are great operations for weight loss and great operations to improve the quality of people's lives. So no matter which one you end up choosing, no matter which one you and your doctor end up wanting to do and sounds right for you, are very, very good, very, very helpful. That's the number one point. Okay. So number one starting point, whichever one you choose is going to be very, very helpful and going to be a good decision for you. Now, there are some subtle differences between them, and there are pros and cons, obviously, of each. And of course, we will sit down and talk to you at great length before you ultimately decide what operation you're going to have. And also, you're going to really have a great understanding of it, so that as you read more and more online, as you talk to friends possibly have had the surgery before, you're going to be a much more savvy consumer, and you're going to be able to say, oh, these complications or these issues that my friend had, that's because they had surgery X or Y, and that's what makes me interested in the different operations. So again, as you hear about the different operations, you'll get a more of an idea of what's what. And I definitely encourage you to do that research, talk to as many people as you can. But in general, there are three major categories of operations that we offer in Mount Sinai, Brooklyn. And that is basically the sleeve gastrectomy surgery. And of course, I'll go through each one a little bit more carefully in a minute, but the sleeve gastrectomy surgery, the Roux-en-Y gastric bypass surgery, and the duodenal switch operation. Those are really the three main categories of operations that are offered in the year 2022 in basically pretty much all bariatric surgery groups. And of course, in Mount Sinai, Brooklyn, we offer all of these. Now, in addition, we also offer a wide range of revisional surgery. So people who have had surgery in other institutions with other doctors are having a problem, or they didn't lose as much weight as they were hoping with other operations or with other doctors or with other groups. We welcome people to come and talk to us. We'll get their operative reports. We'll go through a workup, and we'll really sit down and really understand what operation they had, what problems they're having, and see if a revisional operation, in other words, another surgical procedure to either correct the problem that they have or to improve on the outcomes that they have, we will discuss that with them in detail. Okay, but back to the primary operations, to the operations for people who have never had weight loss surgery. Again, where it's the sleeve gastrectomy, the Roux-en-Y gastric bypass, and the duodenal switch. Those are the three main operations that we do. There are still some people who are interested in the lap band. That's still an operation that we offer to people, but it's not very common. Of those operations, we do some of those operations using the robot, using robotic surgery. And Mount Sinai Brooklyn is a leader in robotic surgery. We have two of the latest high-tech robots that are in our hospital. We do a number of these operations using the robot to optimize people's outcomes and make their recovery faster. So those are definitely options available to you. And in general, the sleeve gastrectomy is an operation where we're removing a portion of the stomach and making the stomach a narrow tube. That's the sleeve. A Roux-en-Y gastric bypass, in general, just in broad terms, is where it's a division of the stomach and a rerouting of the intestines to limit the amount of calories that you can absorb. And the duodenal switch is similar to the sleeve and the bypass in that the sleeve, it creates a long, narrow stomach and also reroutes the intestines. So again, each one of these operations alters the anatomy, alters the stomach and or the intestines so as to reduce the amount of food that you want to eat and reduce your appetite on the one hand, but also reduce the amount of calories that food has, reduce the amount of calories that you can absorb, thereby causing the weight loss that we want. that's in general the operations that we do. And of course, the idea is that there's a lot more detail that we will discuss when we talk about this one-on-one. Of course, before someone considers weight loss surgery, they come in, talk to us in detail at least 2-3 times before their surgery and before a decision is made whether A, they want to have surgery, or B, which operation they want to have. So again, I would just mention that with any one of these operations, there is a significant amount of weight loss that leads to a significant improvement in medical comorbidities. In other words, medical problems that are being caused by the overweight. But in general, the numbers that we usually tell people is that a sleeve gastrectomy, you can expect to lose around 60 to 70% of your excess weight. Okay. Versus a bypass where you're looking more in the 70 to 80% loss of excess weight, and the duodenal switch is more in the 80 to 90% of the excess weight loss. So again, each operation that brings with it some pros and some cons. There's some increased weight loss with some of them, a little bit less weight loss with others, but there are other issues that need to be taken into account when the decision is made. And of course, we will take you through this conversation and take you through the decision very carefully. We'll spend a lot of time having these discussions with you so that you're really educated about this and you're making these decisions, with your eyes wide open. You know exactly what the different options are and what you're getting yourself into. Right. So this is a very common question that we get asked. Most patients at the end of the consultation, particularly the first one, will say, "Well, which operation? So, doctor, which operation should I have?" Right. That's what the question that they ask me. And in general, for most people, it's up to them. The decision is made by the patient themselves. So, what I always tell everybody is, it's your body. It's your decision. You have to be, my job is to educate you so that you know exactly what you're getting yourself into and what each of these operations gives to you. And then you need to make the decision on your own. So there are some medical issues that would make me push people more towards one operation than the other. And of course, that's all part of the discussion. And if, I'm sitting with a patient and I say, based on, you have, let's say, and one great example is, let's say you have person has really, really bad diabetes, let's say, and it's very difficult to control for their medical doctor, and their doctor is giving them insulin and really working hard with them, and they cannot get those sugars under control. A patient like that, I probably push more towards a gastric bypass or duodenal switch, and say maybe a sleeve may not be the best operation for them. Types of conversations like that. So there are definitely medical issues and medical history and surgical history that may make me push a patient more towards one operation than the other. But the vast majority of people, these operations are all great operations for the vast majority of people, any one of them. And therefore, the decision about which one sounds right is really up to the patient. So my job, sit down with the patient, go over each one of the options, the pros and the cons of each, make sure they really have a clear understanding of that. And then the patient themselves can say, you know what? The bypass sounds really best for me, or the sleeve sounds really best for me, and that's the one I want. So, as far as which one I recommend, in the vast majority of patients, the patient decides on their own. And my job is to make sure that they're making that decision with the most information possible. All of these operations are done in a minimally invasive fashion, which means that instead of, in the old days, they used to cut people open and do operations, with their hands inside of the person. Obviously, we don't do it that way anymore. All of these operations are done, again, what's called minimally invasively, or another term for it is laparoscopically, which means that you make small holes in the skin. You put a camera in and you do the operations with very thin, narrow instruments that allow you to work while you're watching what you're doing on the camera. And recently, we've also been doing these operations robotically, which means that, again, they're the small holes that are used, same as laparoscopy, but instead of holding the instruments with your hand, a robot holds those instruments and works in a very, very, very delicate, exact way so that you can do very, very delicate operations, in a way better than the human hand. Now, of course, the robot is being controlled by the surgeon, and the surgeon's in the room controlling it, but the robot is moving the very tips of the instruments in a very, very, very controlled way. This is pretty new to the field. We've been doing robotic surgery over the last 5, 6, 7 years. And the outcomes that I've seen are really, really excellent, better with the robot, I feel. And a lot of these operations are done straight with the robot. But again, the key is that they're all done minimally invasively with these small holes so that the recovery is faster. And the question is there a difference in recovery between the different operations? Not very much. Since all of these operations are done with these small holes, in some ways, what I tell patients is that if you didn't know which operation you had, you wouldn't necessarily be able to tell from the outside because they're all with the same small holes. So the recovery is actually quite similar. So come into the hospital, have the operation, stay overnight one night in the hospital, go home usually the next day, and then it's about the same recovery. Usually for most jobs where, unless there's strenuous or heavy lifting involved, most people can go back to work about 2 weeks after the surgery. If there's heavy lifting or strenuous activity involved, usually it's about 6 weeks from the surgery. But at the end of 2 weeks, most people feel actually quite good. And they're really back to living their life after about 2 weeks. Basically, every insurance nowadays covers these operations for people who qualify. Now, again, what does it take to qualify? It's what we've been talking about. It's a BMI over 35 with medical problems, or a BMI over 40 and otherwise healthy. Exhausted all other tries at losing weight with medical help. Getting optimized for surgery. All those factors. And if you cross all those T's and dot all those I's, basically all insurance needs to cover this, and there's a very good reason for it, because it works. And rather than your insurance company paying for diabetes medicine for your entire life, they pay for this one operation and it cures the diabetes in a large percentage of patients. And that actually saves them money. So, the insurance company's out there not to keep you healthy, but they're out there to make money. And these operations save them money. So every insurance company, for the most part, covers these procedures, and they do not have to be paid out of pocket. So that's a great segue to discussing a very important point, and that is that surgery is the flashy part of weight loss, right? Of the weight loss journey. People, you'll see online, people are constantly talking about, the surgery that they had and documenting their surgery, doing a vlog on their surgery, et cetera. And it is the very flashy part of the process. But it's only one piece of a very large puzzle of success with these weight loss surgeries. So, you can do a surgery on someone, but they're not going to do well if they don't have all the other pieces. And, some of the other pieces are commitment to following along and doing, following along with our advice, with the recommendations, and with the right diet, with the right exercise. All of that is part of succeeding with the weight loss surgery. So an example of that is support groups, and just in general, having support. And, there's a lot of reasons why people are overweight. And it's not just because, they eat a lot. There's a lot of other parts to this, a lot of other pieces to this puzzle. And there's a psychological aspect of it. There's a lot to it. And if you don't have that support, if you don't have a psychologist, if you need it, if you don't have a nutritionist available, if you need it, if you don't have support groups, if you need it, you're just not going to succeed as well. And studies have shown that very clearly. Exercise, if somebody thinks that they're going to have weight loss surgery and, be sedentary, just sit in front of their computer all day long and play video games, and they're going to lose the weight, it's not going to work out long term for them. So, all of these little factors are really important to succeeding with weight loss surgery. And again, you don't want to just have the surgery and lose weight for a short amount of time, then gain the weight back. That defeats the purpose. Again, like we mentioned earlier, that's not good for your health anyways. That's actually worse for your health. So you want to have the weight loss surgery and you want to succeed, right? I mean, that's the whole point here, is that you want to get your weight down to a healthy weight where you're healthier, you're more active, you're enjoying your life. And in order to succeed, all these pieces are needed. And you need the support. You need the psychological help. If that's what you need, it's available to you. Nutrition, a nutritionist so that they can nutritionally support you. We're there for you. If you need to come see the surgeon on a regular basis to make sure that your nutrition is up to snuff, that you're getting your blood test to make sure that your vitamin levels are up to snuff and adequate and healthy. These are all the support that we offer in Mount Sinai, Brooklyn, in one place. And once you come in for your first visit, and we'll start connecting you to our whole network of support that we provide. Absolutely. Ultimately, the whole purpose here is to improve your health and improve your quality of life. And what I always look at this is like a vicious cycle, but in a good way, that people, they go on a diet, they lose, they literally starve themselves. And after 2 weeks, they see like 2 pounds weight down. And they get frustrated with it, and they're like, forget it. I'm going to I'm going to get ice cream and a piece of cake, right? So it's a very frustrating cycle, and that's why people lose 5 pounds, gain 10, lose 20, gain 30. This is the reason why that happens. And the beauty of bariatric surgery is it really gives you a good kickstart, so that after a month or 2 or 3 after your weight loss surgery, you've lost 50 pounds. That is dramatic. You're walking in the street, and friends that haven't seen you in a bit are coming over to you and say, "Whoa, you look amazing. You lost so much weight." And then you go into the gym, and instead of you feeling like, "Oh, I'm carrying around 100 pounds on top of me and I can barely move," you lost 50 pounds. Now you feel lighter. You see the success in the mirror. Going to the gym is a joy. It's fun. It's not a chore. And that's why it becomes the cycle of, you're losing the weight, you're seeing success, so you're more careful with your diet, and you go to the gym more often, so you lose more weight, so you going more, and it's that cycle of just getting that weight down and succeeding. And really, exercise plays a huge role of burning the calories that you're taking in. Right. So again, this kind of goes back to the whole support that we offer in Mount Sinai, Brooklyn. And, the follow-up is extremely important. And, to be honest, a lot of patients really don't do this enough. There are plenty of patients of ours that, they have their weight loss surgery, they do great from the weight loss surgery, and we never see them again. And, it's great for them that they succeeded, and I'm very happy for them. And of course, they are a very good source of referrals for us. But on the other hand, we'd really like people to come back and follow up. One of the many reasons for that is because some of these operations, they have an effect on vitamins, nutrients, and those have to be measured on a regular basis. And people can follow up, of course, with their medical doctor for that, but it's really best to follow up with experts in nutrition, experts in weight loss. And it's really good to continue that follow up and that relationship with your bariatric surgeon. And we always recommend it, and we're always available for that. So yes, so follow up is extremely, extremely valuable for these patients that have had this operation. And also, if God forbid there's any complication down the road, the best people to identify those problems, of course, are the experts in weight loss surgery and bariatric surgery. And the only people often who can recognize a complication are the bariatric surgeons. And I have had experience where people go to another practitioner who may not be so familiar with a problem, and they don't realize that problem that they're having may be directly related to their weight loss surgery. And therefore, they were best served to have gone back to their bariatric surgeon. So we definitely recommend it. And I hope that patients feel that there is an open door policy and a very warm, inviting environment for patients to come back. And in fact, that's what I'm the most proud of in Mount Sinai, Brooklyn, is that Mount Sinai, Brooklyn is a small, family-oriented type of institution where we have the capabilities of the Mount Sinai health system, which of course is one of the most renowned hospital systems in the entire world. So we have that capability that Mount Sinai provides to us. We have some of the top-level practitioners in the world. We have 2 robots in-house that most hospitals can only dream of having. But again, because of the power of the Mount Sinai health system, we can get that in-house and get that expertise in-house. That's on the one hand. But on the other hand, we're a family. All of the nurses, all of the doctors, we all work together. We're in the neighborhood. We're in your community. And you'll see when you come in to visit us for a consultation or, for a recommendation or something, you'll see that there's a much more of a family feel, a personalized feel. You're not just a number, walking into a big machine that's doing thousands and thousands and thousands of cases a year. This is a big thrust of ours, is that we want people to feel that they are part of our family, that once they have surgery with us in the Mount Sinai Bariatrics, they are part of our family for life. And doors are always open. Warm, inviting environment, a VIP type of service where, the nurses, all the doctors, we all work together to provide that feeling and that experience.